sometimes the exercises I'm going through will seem very simple, or you may not feel that you're getting a lot of benefit out of it because you don't have that like strong sore feeling after exercising, or you don't feel like you did a lot of work. But really setting this foundation is very important. And now I want to go into a few examples of these exercises that you can begin. I do tend to have difficulty going over specific strengthening and coordination exercises in larger formats because I'm very used to working with individuals, and every individual really is unique. So I highly recommend that if you are beginning to strengthen your core again after surgery, that you really reach out to your medical team and a professional who can evaluate you and how you're moving. And one example of this is like I personally have had a back injury in the past. And so in my mind, I'm like, okay, I have to keep my body moving and I need to make sure I'm stretching. Um, and so if I look up exercises on how to stretch and work my back, I can find all sorts of things on the internet. But when I actually talk to my physical therapist that I go see, we're able to really hone in on what exercises are beneficial for me. So the same stretches that may work for someone else don't work for me. So I do think it's really important. You can take these exercises as foundation to start with, but really working with someone who can dedicate their time to looking at you and your needs is going to be really important. So today we're going to be talking about 3 exercises to begin with to strengthen your core. And these include pelvic tilts, modified bow and arrow, and single knee dropout. So I'm going to pull up a video. In the video, I'll do a brief explanation of the exercise, and then I'll kind of walk you through that exercise. So we're going to start with pelvic tilts.
Pelvic tilts. Pelvic tilts will teach you to engage your abs so that you aren't compensating and making up for the fact that they're not working as well as they should be. So to start pelvic tilts, you're going to lie down on your back. And when you do a pelvic tilt, you're tilting your pelvis. So you're rounding your back down and drawing your belly button in. And you're bringing your hips up towards your ribs. So you'll lie on your back, bring your knees up into a comfortable position, and I'm going to relax my back. I'm almost going to try to press my back into the ground as if I'm squishing a grape. I want to leave a little bit of a space, but try to press it down. And then I'm going to round back and tilt my hips towards my ribs. And then I'm going to relax and let my pelvis rotate towards my feet. So back towards my ribs, pulling my belly button down, and then relaxing, tilting back towards my feet. And you don't want this to be a huge movement through your legs or rocking your hips, it's just slight back and forth. So I'm going to tilt back, pull my belly button in, try to squish that grape under my back, relax, tilt my pelvis down and away. Another way to do this if you're having trouble is thinking of putting a marble between your fingers and your thumbs. So you're going to be rocking that marble down towards your index fingers and back towards your thumbs. So if I place my hands on my lower abdomen, I'm going to tilt down towards my index fingers when I relax, and then I'm going to pull back, roll that marble back towards my thumbs. Down towards my fingers, back towards my thumbs. Good.
All right, so again, another very subtle exercise. And this one is one, like I said, you can work it out on your own, but it's also really helpful to have someone with eyes on and hands on to see how you're moving back and forth to help with strengthening. All right, next we're going to pull up bow and arrow and go through that exercise.
The modified bow and arrow exercise is a great exercise to lead into more thoracic or upper trunk mobility down the road. When you're first starting out after surgery, we really want to avoid overly twisting so that you're not pulling on your incisions. So that's why we're going to modify it for now. So you're going to lie down on your side, and to ensure that you have proper spinal alignment, you're going to put a pillow between your legs, and then for comfort you can put one up by your head as well. And then you're going to bring your hips to a 90-degree position, or as close to that as you can get. You're going to bring your knees out to 90 degrees as well. And then you're going to lay your top hand on your bottom hand. And then you're going to slide your arm back over the bottom hand and out behind you. And then come back in. And while you're doing this, you want to make sure you're not rocking. You're going to engage your core. Keep your pelvis and your core really stable. So activate your core, then slide your arm out and back behind you. And then you're going to come back.
All right, so for that one, like I said, this is a modified technique. So if you're really in the early stages after surgery, just working on that rotation of your arm can be helpful. And then as you progress from surgery, you can start to really rotate your trunk a bit more. This is something I've talked with a colleague about, how we're finding a lot of folks after surgery, like I said, get really tight through their entire trunk and almost lose that rotation or that ability to rotate, I think, because we get really concerned about moving or just stiffen up. So it's really important to maintain that rotation as you go. We'll quickly look at single leg dropouts, and then I think for time's sake, we'll have to kind of keep plugging away at things.
Single leg dropouts activate your pelvic floor and your core, and they bring in the added challenge of your leg to challenge your pelvic stability. So for single leg dropouts, you're going to lie down on your back. Find your neutral spine position with your knees bent. Slowly, you're going to keep your core activated and let your knee drop out to the side. So you're going to start with one knee at a time. And then you're going to drop it out, and as you bring it back to center, you want to stay nice and controlled and make sure that you're activating. So you're going to drop out and back to center. And your opposite leg should stay nice and stable, so you don't want it to be wobbling out to the side. You don't want it to be trying to counterbalance you and your pelvis by bringing it out. So again, you're going to bring your one leg out to the side, keep your core engaged, your leg neutral, and then coming back in. Another
Sorry, I was muted there, but that's the single leg dropout. And like I was saying, that one's really about control and stability in your pelvis and your lower abdomen. So just like with the breathing and the mobility, how it's easy to just get up and move. For that exercise, it's really easy to just be like, oh, I dropped my leg out and I brought it back in. Pretty simple. But if you're really stabilizing, it can actually be pretty challenging to drop your leg out without letting the other one waver at all. So just something to think about, that really deep control is really important on that exercise. All right, so that is a very quick overview of some exercises you can start doing. There's definitely more to build off of, but those are some really good foundational tools that you can incorporate into your routine. And I myself even go back to those every now and then if I'm like, okay, I've been doing a lot of really hard exercise, but I want to do a check-in on where my deep core sits. And sometimes I'll find that even I struggle with those exercises if I haven't been working on them in a while. So even if you're years out from surgery, you can always benefit from coming back to these foundations.